Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and MediSpa. Welcome to Bellissimo Live. In this episode, I want to talk about 3 brand new technologies that we just added to the practice. On my left is our newest laser. This is the chrome laser. I'm really excited about this because this laser combines 2 different wavelengths, a 532 and a 1064. What that means is that it allows us the capability of treating many different skin types, also skin lesions and skin problems. We can treat any skin color or skin tone with this laser. It really kind of zeroes in on pigments. So this laser is great for melasma, telangiectasias, which is really those little spider veins you get around your cheeks and around your nose, rosacea, aging spots, sun damage, any of the kind of the darker skin colors or spots that we're getting. We can use this all over the body. We can get it on the back of the hands. So this is a great technology. It also has a Q-switch mode, which means that we can break up color for darker skinned individuals without using heat. And so patients that have hyperpigmented scars after surgery, also darker skinned patients that have the same thing with melasma and also darker spots, this laser can be used safely and efficiently. There's 3 areas that we use it for. The first one is called a NaturaPeel, which is kind of nice. It's when you come in, we actually treat you. We put some cream on. It's a bamboo charcoal mask. We put that on, allow it to dry, and then there's 3 stages or 3 steps of the laser. One of them is to dry it. The next stage, the laser actually just sort of obliterates that mask. And then the next one, it allows the nutrients in the mask to actually penetrate the skin. So it hydrates the skin, gives you the skin a nice glow, very dewy feel. This is really nice as a NaturaPeel. We can also treat the décolleté area for a lot of women, especially that sun damage, that kind of crepey skin, those sunspots that you're getting, coming down on the neck and treating that. This laser is fantastic for that. Again, little to no downtime with it. Lastly, is we have a setting on it called Refresh. That's a light resurfacing, some fine lines, and we can combine that with other lasers. So we've talked about the CO2 laser that we have. We can combine this with the CO2 laser. We can combine it with other modalities or other treatments that you might be having in our aesthetic center. So welcome Chrome. This is really a tremendous device. We are getting ready to launch this probably in the next 3 to 4 weeks. To my right is Virtue. You've heard me talk about this in the past. This device has been a workhorse for us. This is a combination of microneedling and radiofrequency. This is the handpiece that we usually use. It's called the Smart Handpiece. Again, 36 needles, and with the tip is what the radiofrequency pulse comes out of. So these are tiny, fine needles. You don't feel it. We do some topical numbing over it. But this handpiece we've been using for the last several years. It's great for treating scars, especially acne scars, chickenpox scars, trauma scars, all of those scars. It can soften them. It also resurfaces the skin a little bit. It penetrates to about mid-dermis, that deep part of the skin. So as the needles go through, it gives you sort of this micro fracture of the skin, which causes the skin to repair. And that pulse of radiofrequency, that little wave comes out, it causes a little bit of heat to the skin, and that causes the collagen in that dermis to shrink. So it can kind of tighten the skin, give that skin a nice plump feeling. So this handpiece has been a workhorse for us, but we just added 2 handpieces. These have come out in the last year from this company. The first is called the Deep Handpiece. It looks very similar to the Smart. Again, same kind of 36 needles with the tip giving off a radiofrequency pulse. These needles can penetrate deeper, up to 6 millimeters. So we're using this under the neck, under the chin area, really in the upper part of the neck. We can treat the buccal fat pad that a lot of people want to have removed. We can do that non-surgically. But underneath the chin, it can help decrease a little bit of the fat that might be accumulated there over the years. Also can help tighten that skin just a little bit. So some patients that really aren't ready for a surgical treatment or liposuction, this handpiece can be used to really kind of tighten this area up. We're seeing some really nice results with that. Other areas of the body that we're starting to really kind of look at and test right now back of the arms. We have ladies that come in that have a little bit of extra fat, a little bit of loss of skin tone. We can treat this again non-surgically and minimally invasively. Again, all we would do is put some numbing cream on there. We can do around, areas of the belly. We can do like inner thighs where that skin is a little bit crepey. So again, we're just starting to work with this. We've treated a few patients with it. We're seeing really nice results. I have a couple of colleagues that have had this a couple more months than I have that really love it. So the deep handpiece may be a real game changer for those patients that, again, have a little bit of laxity, a little bit of crepey skin that we might be able to tone up without any type of laser or any type of surgery. Lastly, this handpiece is an amazing technology. This is the exact handpiece. It's a single needle, and that's really to be used around the eyes. So I would use it underneath the eyes, in the lower eyelid. The couple of patients that I've tried it on so far, it really treats that crepey skin, and we're seeing some really nice tightening of that skin. Any people that have a little bit of bags, that instead of going to surgery, this can treat that. Also, when patients get a little bit of swelling down in the upper cheek area, called festoons or malar bags, in the past, those are hard to treat surgically, and there hasn't been really anything to treat them well. This handpiece, the exact handpiece, seems to treat those very well. So again, we're working with these two new handpieces. We're trying them out. And just like everything else that we do here at Bellissimo Plastic Surgery, we really vet it out. So we have probably about another month, 4 or 5 weeks before we release it. We're going to do a second round on some patients and see how they do. And that way we can give you some really good advice about who it works on, the longevity of it, how many treatments. Sometimes they'll take anywhere from 3 to 5 treatments, about a month apart. So again, for patients that are really not wanting to go to surgery yet, around the eyes, this is fantastic. There's also maybe around the mouth. I have a couple of patients I'm going to try that on, because that would be a real game changer, because as everybody knows, that's a really hard problem to treat. These perioral rhytids are tough. We've tried Botox and fat injections and skin resurfacing and a whole bunch of different things that we've tried over the years. This new exact handpiece may be a little bit better at treating it than everything we've tried so far. The last piece of equipment I wanted to talk about is the LipoAI. This is made by Deca. This is based on laser liposuction. This is revolutionary because this can bring liposuction to the office. So as we do traditional liposuction in the operating room, this can also be done in the operating room. However, this is based on a modality of laser liposuction that's been around for approximately 12 years. But this device is now portable. It comes through a 2mm fiber optic cable. So you have a very nice small handpiece. I make a tiny little 1 to 2mm stab incision in the areas that I want to treat. And then this device generates a laser, basically a laser beam through the tip, and it helps dissolve the fat in the area. So it not only emulsifies it, but actually can kill fat cells. So I've been using this here in this procedure room under really local tumescent fluid. I give patients some oral sedation, but they're awake during the surgery. They're very comfortable. I've been treating areas underneath the chin and what we call the submental area. We can treat arms, treat bellies, hips. We can treat men's chest, axillary rolls for women, chest walls, hips, thighs. We've done lower legs or calves and resculpted those areas. So this can be used in just about any area of the body safely. Again, the whole procedure takes about an hour, hour and a half, depending upon the area and the amount of fat removed. So this device is just so revolutionary to us. So now I have a way of treating, as we found, the Virtue device with the handpiece sometimes in the submental area, sometimes the arms and the legs in that area. If it's a little more than that, then I can come over into this room and use the LipoAI. If it's even more than that, or I need more sedation, or I need general anesthesia, then I would take the patient over to the surgery center and do the surgery there. The nice thing about this, patients come in, as I said, they were awake through the surgery. We also use Pronox, which is a combination of oxygen and nitrous gas, so it keeps them very comfortable. After the surgery, there's really no recovery. We get them dressed, put them in their garments. The small, tiny percutaneous incisions that I make, I just basically close them with steri strips. There's no sutures, and they walk out and they have a driver that takes them home. So 3 new technologies that we've added. The nice thing about this, with the laser and the chrome, all of the other lasers that we have, we can treat just about any skin condition. We have Modus as our hair reduction, so it's quicker and non-painful. We have the LipoAI, we have the CO2 laser for resurfacing, we have the Virtue, which can treat resurfacing, scars, we can treat unwanted fat, some crepey skin, even under the eyes. So we have a lot of modalities here in the aesthetic center, across the hall, and in the surgery side that can basically treat just about anything that you might want to be interested in. So if you have any questions, please call us at the office, look at our website. Again, I'm using this device now. We're doing this once a month. The other 2 devices, we should be ready to go in about 4 weeks when we get a little bit more information. Consultations are required, so you will have to come in to see me about this. The chrome, the laser I just talked about, you can do a consultation and treatment on the same day. The Virtue device, depending upon what you're interested in doing, I would probably want to see you first to make sure that that modality is correct for you versus this versus something in the operating room.